Hello, Dr. Butterfield here. I wanted to make a quick video about headaches. Headaches is something that comes into practice all the time, and I've been able to resolve headaches, most headaches, pretty quickly using the TBM technique. I say pretty quickly, I mean by the time we're done with the session. I'll do a correction and it's very oftentimes just gone, okay? So in TBM, we have, there's like 7 different sources of cephalgia or headache here. And the first one is on top of the head, can oftentimes have to do with some sort of reproductive dysbiosis. On the temporal fossa, so right here above the ears, that can be related to cranial correction that we do for the pineal gland. So sometimes that's related to emotions or sleep, something like that. Next one, if you're having pain at the base of your skull, here at the top of your neck, that's usually a structural problem, and that needs to be resolved through some sort of osseous adjustment or bone manipulation. Next one is if your sinuses are hurting, it's probably your sinuses. You're having some sort of congestion or sinus infection. Next is the frontal bone here or behind the eyes. A lot of times that's an issue with either blood sugar regulation or cellular energy production. So think energy, and we have a great correction for that as well. If it's a global head pain or a migraine, that's usually having to do with liver or a toxicity problem. And so we have corrections for all these in TBM. We can clear them up really quickly. There's another one that came into my office today that prompted me to make this video. And it was a headache that was highly based in emotions. And the woman came in, she'd been experiencing the headache for a few hours. And I believe it was kind of on both sides, right here. And normally that was, I thought pineal, but pineal correction wasn't enough. And I found we need to do some emotional correction. So this says, the body weeps the tears the eyes refuse to shed. And I've seen that time and time again in practice, that the mind-body element is a really important component of someone's health. So we have a technique called neuroemotional technique, or sometimes I'll use TBM for the head pain as well, or for any sort of symptom. And her head pain was changing dramatically. We were correcting one emotion at a time, and the first one was sadness that she was experiencing in her life right now. And then the next emotion was anger. And after we cleared the sadness, then the pain kind of moved back and it diminished, went back further into her head. And then once we cleared the anger, then her pain moved to the other side of her head and it was even less. And then the last emotion was paralyzed will, feeling kind of stuck, like can't do something that she wanted to do. And once we cleared that, and the headache was gone. And it had been there for a few hours. It quit within, as soon as we did this treatment. And it was a really profound experience for me and for the patient. And so this is something great. If you have headaches, come on in. We'll fix your headaches. If you know someone else who has headaches, then we'll work with them too. Don't fix 100% of headaches. Some are trickier than that, but we have a great batting average. We do a great job with most of them that come in. Just want to share that. Cheers.